Good morning, Patrick here again, live from Complete Health, and I just pulled up to work. I thought I'd just jump on and explain some of the training that we go through as chiropractors, because quite often there's this misconception that chiropractors are just those people that crack or whack or jump up and down on people's joints, and there's a lot more to chiropractic than probably meets the eye, and the majority of people probably don't know quite the level that we go to when we're at university. So the average chiropractor will spend somewhere between 4 and 5 years at university learning skills such as diagnostic imaging, human anatomy, and that includes muscle anatomy, neurology, bone anatomy, circulatory anatomy, connective tissues, tendons, ligaments, you name it. If it's in the body, we probably had to study. We even had to do cranial anatomy and know exactly where all the bones in the skull were. We even had to break down the brain into different segments and which part of the brain controlled which part of the body. And the reason why we go to such depth is that when someone walks in with a postural abnormality or a muscular abnormality or a circulatory issue or even something like cancer, that we have the skill sets to spot those things because we are a primary healthcare practitioner. And trust me, the course is not simple. It's complex. And actually, interestingly, I believe it is in Denmark, that in Denmark, chiropractors and doctors, they do their studies side by side for the first 3 years. And the main reason being is that you have to learn the biology, the anatomy, the biophysics, the chemistry, all of the basic sciences that you need to understand to be able to understand the way that the human body works. You have to learn that stuff first. And they have to learn the same kinds of things as doctors because, by the way, we both see patients that will present in the same way. Like, say, for example, someone with a pancreas problem can present with shoulder pain. Someone with a heart problem can present as arm pain. Someone with kidney problems can present as lower back pain. And so if you're not actually skilled enough or understanding enough to actually know what's going on in those situations, it's super simple to actually send people to the wrong places or do the wrong things and start adjusting someone's spine when really they should be on antibiotics to clear up a kidney infection. So if you've ever wondered literally what the training is like, I would have a look at our curriculum because it's extensive. I did mine as a 3-2, which means I did 3 years as a bachelor's of human science and I did 2 years as a master's in chiropractic. So I've done 5 years at university and I still continue to do a minimum. Personally, I go above and beyond. I probably do over 100 hours of training every year and I probably attend a seminar every other month apart from this year. This is the first year that I haven't attended seminars every other month since I graduated from school because quite simply they're not on. However, I had a coaching call last night. I've got another coaching call this evening and I'm probably still spending about, 5 or 6 hours on calls with other chiropractors going through clinical cases, neurological discussions, x-ray discussions, etc. So in case you're wondering, what do you have to do or what do you have to go through? Maybe you wanted to become a chiropractor, maybe I've just put you off. Don't let it put you off. It's probably the best decision I've ever made in my life. I'll see you guys again tomorrow. If you've got any questions about some of the training that we maybe have, maybe you've got a question, like maybe there's something you've got going on, you've got a problem going on and you don't know who can help you, ask the question. Just put it in the comments or private message us. A lot of people are surprised actually at what extent our knowledge stretches to. And if, by the way, it's not something that I can answer the question to, I can normally send you to the right person. Till tomorrow, take care. Patrick here from Complete Health.